I'm back, and I'm here to talk a little bit about my practicum and how I use Competency 6 in my practicum. Jack and I actually use quite a bit of research in our everyday jobs and our practicum. We're constantly having to look up new information to present to our patients. So, for instance, we both do a PRTF group with kids ages about 9 to 18. We do that once a week. It's a substance abuse prevention group, so we're presenting materials, usually video lectures. They give them good information about substance abuse, about alcohol and drugs, so that they can make informed decisions if the time ever comes that they're peer pressured into doing so, or if they have done so already. It's just good to have the information and be informed. So we want to use these materials to keep them entertained as well as learn new things. The problem is some of these materials are old. I mean, they're in the 80s before these kids were even thinking about being born. So we're constantly looking for new stuff, something from the 90s at least, even the 2000s, so that they can relate a little bit more to it. And that's been an ongoing mission for us to find that type of stuff. We're also constantly looking for things to add to a library that we actually started on our unit. It's recovery related materials, so we've got AA books, NA books, and just some different recovery related stuff, and we're constantly researching to find new additions that we could add to our library. So besides the group and the researching for that group and for our library, I also do some follow-up phone calls. So I call clients that have already graduated to check in on them, see how they're doing. And the reason that this is research related is because we keep data on all this when we call, how they're doing. One of the main things is seeing how we can help them or how they felt about our service while we were here, so that we can make changes according on what they say. So if they say that AA groups or Celebrate Recovery is something that has been really great for them, that has kept them sober, then maybe that's something we need to incorporate more in our program. And that's how you take research, which is me calling them and seeing what's up with them, and then putting that into our practice and changing kind of the way we do things. And these follow-up phone calls are something that we added a couple years into our program. It wasn't something that we had at the beginning, and I think it's really something that's good because it's able to give us some outcomes so that we can bring it back into our program and make sure that we're giving people what they need and serving them to our best ability. So that's kind of my practicum in a nutshell, research-wise. We're just constantly trying to make sure that we're on top of things, that we're providing best practice. So thank you for listening in, and once again, go Lady Shocks.